We're honored to be joined by Andi Williams, who is executive director of an organization called Community in Crisis. Good to see Andi.
Good to see you too. Thanks very much.
Andi, back in 2013, 2 overdose deaths in the space of just a week in Somerset Hills in New Jersey led to the beginning of this organization, this movement. What is it, and what impact are you having?
Well, we began as a small group around a kitchen table, all volunteers, and we decided there and then that we needed to do something to prevent any more overdose deaths as best we could. We've come an awfully long way since then. We look at ourselves as kind of 2 pillars of focus. The one side being prevention education, raising awareness about the dangers of substance use. So preventing that path before they even start down it, hopefully. And then the other end, we're like the bookends of substance use disorder. The other end of that would be helping people seeking and in recovery find sobriety and lead a healthy and fulfilling life.
We're putting up the website as we speak right now.
Thank you.
Why, from a personal perspective, Andi, obviously you care as a member of the community, someone who cares about the people in your community. Is there a personal connection for you?
Well, fortunately, not within my immediate family. I would defy anyone to say that they didn't have it, in their larger extended family.
Absolutely. Same here.
Yes, definitely. But I have 3 children, all of whom are now in their 20s. And, it was there, but for the grace of God, that helped me sort of really be driven by the passion. Because, I realized there and then when I saw which 2 kids had actually overdosed during that particular week that you referenced, I knew it could have been my kid, successful, seemingly no cares in the world, just had everything in life to look forward to. So that's been my driving force. And I think that applies to most of our staff here and volunteers too.
Have we done enough, Andi, to destigmatize the issue of use of drugs, opioids, et cetera? Have we done enough to do that?
Well, when you talk about stigma, definitely not. A report came out not that long ago from Shatterproof that actually said that even amongst the medical community, there was a high percentage of people who still considered individuals suffering with substance use disorder as having made poor choices, being weak, and just terrible attitudes towards it, when at the end of the day, our message is that substance use disorder is a treatable chronic disease, like diabetes, like cancer. And the more that we spread that message, the more support we will be able to garner, and the more individuals will feel that they're being understood and listened to, which doesn't often happen.
By the way, you talk about, I ask every not-for-profit leader this question, you have to raise money on a regular basis, right?
We do.
Foundations, corporations, correct?
Yes.
Yeah, it never ends. Real quick, can I get 30 seconds on harm reduction? What's harm reduction?
Well, harm reduction is a little controversial, but it's evidence-based, and it's everything from using Narcan, which is an opioid antidote reversal. It's a nasal spray and also an injection to reverse the effects of an opioid overdose. To using fentanyl test strips to check and see if a substance actually contains fentanyl, because as little as 2 milligrams can potentially cause a fatality. It can be medicated assisted treatment. So it's really about meeting people where they're at. It's understanding with compassion that they have a disease and that they need help. So it would be like saying to somebody with cancer, okay, just get well by tomorrow. Take this treatment and get well. It just doesn't happen that way.
Yeah, I'm sorry. It's one thing to talk about recovery, which is incredibly important, but prevention it's not one without the other. Andi Williams, who's Executive Director of Community in Crisis, I want to thank you so much for joining us.
Thank you so much, Steve. I appreciate the opportunity.
Okay, that's Andi. I'm Steve. Thank you so much for watching. We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, RWJ Barnabas Health, Operating Engineers, Local 825, IBEW Local 102, Eastern Atlantic States Regional Council of Carpenters, the New Jersey Economic Development Authority, Wells Fargo, the New Jersey Education Association, and by Suez North America. Promotional support provided by New Jersey Globe, and by the New Jersey Business and Industry Association.
I'm very grateful that I'm still here.
That's me and my donor when we went to celebrate our first anniversary.
With a new kidney, I have strength.
They gave me a new lease on life.
I'm still going everywhere and exploring new places.
Nobody thought I was going to be here. Nobody.
And I look forward to getting older with my wife. That's possible now.
We're transforming lives through innovative kidney treatments, living donor programs, and world-renowned care at 2 of New Jersey's premier hospitals.
They gave me my normal life back. It's a blessing.
RWJ Barnabas Health. Let's be healthy together.